Hi everyone, I'm PresentationBearse. This is my family theory presentation for Nursing 714, Family Theory and Health Promotion. So nursing is caring for and being with your patients and family as a unit. Communicating with family units requires an understanding of their social, religious, cultural, and ethical beliefs, as well as education and access to resources. Nursing theories and frameworks shape guidelines. These guidelines help direct nursing care and offer direction for nurses across a spectrum of family unit types and needs. Evidence-based guidelines improve quality care and satisfaction. Roughly 56 million deaths occur each year. 300 million people are affected by end-of-life decisions and care. It is imperative that nurses have guidelines to ensure the most compassionate care can be given for the dying and their families. For my theory presentation, I have selected a nursing theory that I am passionate about. Working in the ICU, I care for my fair share of patients and families at the end of life. In this presentation, I will describe to you the peaceful end-of-life theory, the application of the theory to nursing, and research that has guided this theory. Cornelia Ruland was very passionate about positive end-of-life outcomes and has largely structured her theory on patient preferences and shared decision-making. The peaceful end-of-life theory is a middle-range theory created in 1998 alongside Professor Shirley Moore. The peaceful end-of-life theory is underpinned by Donna Bidian's model of structure, process, and outcomes. In this theory, the structure is the family system. The process is the nursing interventions aimed at producing positive outcomes. Major concepts of a peaceful death include being free of pain, being comfortable, dignified, respected, at peace, and with loved ones. This theory is also underpinned by Brandt's preference theory, defining end-of-life goals as getting what one wants. Two major assumptions for this theory to be effective include nurses' abilities to individualize care, continually assess for cues and needed interventions, and anticipate therapeutic needs. In this theory, family is defined as a connected unit and system. Health is focused on emotional health and support during the transitional period. The goal is to maximize care by offering the best possible comfort care options. Environment is defined by the comfort of the atmosphere, including temperature, noise, lighting, comfort for the patient, as well as the family. Nurses are the imperative role to guide peace during end-of-life care and excel in assessing and intervening to maintain comfort for the family unit. So the key concepts identified for peaceful end-of-life outcomes are freedom from pain, including pharmacologic and non-pharmacologic treatment, such as pain medication, sensory stimulation or relaxation, guided therapy, and massage. Comfort can be provided with relief of physical discomfort, such as nausea, anxiety, pain, relaxation, and comfort for loved ones. Dignity and respect is given to patients and families by offering inclusion in the patient care and planning. Empathy can be offered, attention to needs and wishes, and offering respect and privacy. Being at peace can include providing emotional, spiritual, religious, and family support. Being with loved ones ensures that no one dies alone. We include family, offer comfort, and assist through grief by being with. These concepts are largely intertwined and reliant on one another for positive outcomes. For example, if a patient is in pain at the end of life, they will not be comfortable. They will not feel respected or at peace, and they may not be able to enjoy time with their loved ones. If the patient is nauseous or anxious, it may create emotional pain and they will not feel comfortable or at peace. If a patient or family unit is disrespected or treated without dignity, it will cause emotional pain and anxiety, and no peace or comfort can be attained. If a patient is lonely at the end of life, they will feel emotional pain, anxiety, and disrespected. Positive outcomes occur when each area is achieved. Nurses are the faces of caring and can impact and facilitate family unit peace during end-of-life care. Using the peaceful end-of-life theory to guide care has a huge impact on families' perceptions of care and grieving. Nurses exemplify verbal and nonverbal communication and interventions to help families attain peace and move through transitional periods. Nurses advocate for their patients while including the family unit in care plans. Following the 5 key concepts of this theory while individualizing care leads to improved quality outcomes. Nurses incorporate the family unit as a whole and understand the importance of compassionate palliative care following the key concepts. The peaceful end-of-life theory gained international recognition for identification of its key components. Kong-Swan and colleagues cited the theory as possessing the essential qualities for a peaceful death in many cultures. Kong-Swan and colleagues developed a conceptual model and obtained qualitative and quantitative research on peaceful death in ICUs in Thailand and cited the 5 qualities as being important for a peaceful death. Renea Beckstrand developed her doctoral dissertation questionnaire titled National Survey of Critical Care Nurses' Perception of End-of-Life Care Being Strongly Derived from the Theory. Kirchhoff and colleagues used peaceful end-of-life theory as a featured topic for continuing education for critical care nurses and cited this theory alongside the American Association of Colleges of Nursing, competencies and recommendations for educating undergraduate nursing students, guidelines to prepare student nurses to care for the seriously ill and their families. So the goal of the theory is to offer the most peaceful and smooth transition while recognizing the need for individualized adjustment for families and patients as a whole. The peaceful end-of-life theory is geared and focused toward end-of-life care, but can be easily applied to a multitude of grieving and traumatic situations. Key concepts are clearly defined and easy to translate across individualized plans. And here are my references. All right, thank you guys. Have a good day.